Hello and welcome to Roundtable. How much of a risk is the UK taking in opening up when COVID is far from beaten? July the 19th has been labelled Freedom Day, but does the F actually stand for fear? There are so many uncertainties. Cases are still rising, but the Prime Minister Boris Johnson says it's now or never. And other countries are watching to see if the experiment works or if it leads to rising deaths and further lockdowns. Welcome to the programme. I'm David Foster. Today, leading medical experts will help us through what success or failure would look like and what can be done to keep this coronavirus at bay for long enough to know if it can be beaten. England has moved to the final stage of lifting COVID restrictions. It means an end to almost all formal rules on social contact. Rules in Wales, Scotland and Northern Ireland are different, but are also being relaxed.
We will stick to our plan to lift legal restrictions and to lift social distancing. But we expect and recommend that people wear a face covering in crowded and enclosed spaces where you come into contact with those you don't normally meet, such as on public transport.
Government advisors say there could be as many as 1,000 to 2,000 daily hospital admissions over the summer as restrictions are lifted, and 100 to 200 deaths a day from people with COVID-19. Senior doctors are warning of what they call devastating consequences of relaxing the rules. Dr. Chand Nagpal, chair of the British Medical Association Council, said it's irresponsible and frankly perilous that the government has decided to press ahead with plans to lift the remaining COVID-19 restrictions. With a significant proportion of the population still not fully vaccinated and the rise in COVID cases, is the UK opening up too soon? Well, we welcome back to Roundtable three of our guests today. First is Dr. Jeremy Rossman, Honorary Senior Lecturer in Virology in the School of Biosciences at the University of Kent, just happens to be in Chicago. In London, we find once again Oksana Pyzik, Global Health Advisor, Lecturer at University College London, and then we head to Bath, and we welcome back Dr. Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter's Medical School. Bharat, let me come to you first of all. Chand Nagpal, Chair of the British Medical Association Council, said irresponsible, frankly perilous. What do you make of his remarks?
Yes, it is very concerning, and I'm not in disagreement with Chand Nagpal, for whom I have a lot of respect, and the BMA Council. It's not only his decision, but it's the decision of the BMA Council, lots and lots of learned people in the BMA Council. So, of course, we are concerned. I appreciate Prime Minister Johnson is impatient to get things moving, but it is better and important to get things moving in a measured way rather than all bets are off on 19th of July.
He says summer months, schools closed, there couldn't be a better time to do it.
Well, I can't understand the logic behind that assertion, which is the schools are closed, it is the best time to do it. The best time to do it is when viral activity is in a controlled manner and in smaller numbers. In other words, viral activity in the community is low and we are on top of it. That's the best time, rather than to try and sell the seasonality of SARS-CoV-2 infection. SARS-CoV-2 infection does not have a seasonality to it.
Jeremy, let me ask you this. Government advisors, SAGE scientists, etc., say there could be as many as 1,000 to 2,000 daily hospital admissions, 100 to 200 deaths a day, we are quoted. That is a 10% mortality rate of those admissions dying with COVID-19. That is an extremely high level, isn't it?
We're seeing something very different in this wave than we've seen in previous waves, which is a dramatic reduction in fatalities and a reduction in hospitalizations, and that's due to the vaccination rate. It's not perfect. We are seeing rising hospitalizations. But if you look at the rate of fatality increase, it's very small right now compared to previous waves. And that's due to the vaccination rate.
So is that an exaggeration? 10% mortality rate of the coronavirus cases admitted to hospital, 10% of those will die. Is that over-egging it?
It's one way of looking at it, but then you're only looking at the rate of fatalities of people that are admitted to the hospital. That's not saying that's a 10% rate of fatality of people that are getting infected with coronavirus, which is a very different thing. And we're seeing right now that a lot of the COVID fatalities are coming from people that have pre-existing conditions. And so you're getting this skewing of who's going to the hospital that is changing that fatality rate and isn't giving a real reflection of what the fatality rate is in the population overall.
Oksana, I think you believe the UK is acting as though it's all over, that the worst is behind us.
Right now, we are quite opened up. We're only removing items such as face masks and other social distancing requirements, being careful around travel, etc. So really the leap between how we are behaving now and then that sudden shift in a couple on the 19th. In this, we should be looking not only at the models. There's a lot of uncertainty there. We know that some projections are at about 2,000, but the worst case scenario is closer to 5,000. And we also need to take into consideration the impact of long COVID, which we still don't fully understand. So I think that in this instance, if we were to continue on the use of face masks in certain settings, rather than just leaving it for businesses and organizations to decide for themselves, we may be finding ourselves in a safer position come the winter where more respiratory viruses enter the mix.
But I wonder if what Boris Johnson and his government are actually saying is that there is never going to be a good time to do this. We have to learn to live with this disease, and we can manage it now, Oksana.
Well, learning to live with the disease doesn't mean that we do nothing in the face of other diseases. We still have mitigating factors. One of the ways we could live with COVID is to ensure that there's proper ventilation and air purifiers in schools and offices, like they are doing in New York in the United States. That is a concrete action that could be taken forward. Just in the way that we demand clean water, we should be demanding clean air.
Bharat, you wanted to say something on that point.
Yes, I was furiously agreeing with my colleague Oksana that this narrative of learn to live with it is not the way forward. As Oksana has clearly articulated, when we learn to live with it, we need to learn to live with it with mitigations put in place. One of them is extensive immunization of people, including children. So the United States, Canada, Israel, Netherlands, France, Hungary are already immunizing children 12 years and above. And in our United Kingdom schools, we've paid lip service to the engineering, to the investment required to improve ventilation and make the environment safer to allow business continuity in schools. We must address all of these issues. It's not good enough to say, learn to live with it.
Jeremy?
Oh, I completely agree here. And there are better times to ease restrictions and there are worse times to ease restrictions. And easing restrictions in the middle of spiking cases is not a good time. And we don't need to live with COVID fatalities. We don't need to live with significant numbers of people developing long COVID. We don't need to live with kids developing long COVID when we can be working on our vaccination campaign and keeping very simple precautions like face masks and ventilation.
But it's about people taking personal responsibility, isn't it? And you're really not talking about human nature here, Jeremy, when you say, you've got to keep these restrictions in place. People are getting fed up with it. Some people are ignoring the restrictions that have been put in place. You've got to test it, haven't you?
Having some level of freedom is great, but putting all the responsibility on individual actions doesn't work. We've seen that in the US, where I am. You can see a lot of areas where face masks are now optional, and a huge number of people aren't wearing face masks. It's there's simple precaution that don't dramatically affect how you're going about your life, that make a huge difference. A little bit of ventilation in schools, that is not a huge restriction on your freedom, but makes a big difference on transmission of the virus.
Okay, so just tell head teachers and teachers to keep the doors and windows open. That would help. I mean, I'm not being silly here. That would help, wouldn't it?
Yeah, very simple ventilation. It doesn't mean like an entire renovation of the HVAC system. You know, opening windows, opening doors, adding very cheap air filters. There's a lot of things that you can do, and face masks are one of them. It's one of the most effective things that you can do.
Okay, let's hear from a guest on a previous program, a previous round table, not so very long ago. This is Antoine Flau, who's director of the Institute of Global Health. He was talking to us out of Geneva.
All of us in continental Europe, we are really watching what is happening in the UK and in Portugal to see to what extent we can follow the same approach. Many of us, I am an epidemiologist and not a politician, but many of us among the epidemiologists and scientists do believe that it is a very risky approach and attitude. It's just betting that you will not experience a wave in the healthcare system, in hospitalization, in complication and death.
Oksana, any one of you can comment on this, but I'll come to you first, Oksana. He seems to be saying that the UK is being regarded as an experiment. We are the petri dish of Europe. What are other countries looking for? Success or failure?
Well, certainly if we look at countries with even higher vaccination rates, so the UK has been lauded for its exceptional vaccine rollout, but countries like Israel, which are even further ahead and have younger populations vaccinated as well, have reintroduced various restrictions, including face masks, due to this nature of the Delta, which is more transmissible and can result in increased admissions. And that is a big concern.
They call it soft suppression in Israel, don't they? And in the Netherlands, the Prime Minister lifted some restrictions, Mark Rutte, and now he's had to apologise for what he calls his own poor judgment. So what are they waiting to see? Bharat, what do you think? What are they waiting to see?
Well, what we want is to open up businesses, but at the same time keep infections under control. And as other colleagues have already articulated, simple measures go a long way. Ventilation, fitting of masks, wearing proper quality masks, and other little restrictions will get you very far. And some things just cannot be allowed. So, for example, a crowded nightclub is full of lots of risks. So you would have to say certain soft restrictions have to be in place.
You talk about nightclubs. 3,000 seated spectators at sports stadiums in Sweden. That's as many as they're allowing. Take a look at what we saw at Wembley Stadium over the last month or so. Up to 67,000 people. Is that worth taking a risk for?
Whilst the conversation is that this is an outdoor event, the failure is to address that leading up to the event, people get up to all sorts of things, buses, trains, pubs, restaurants, etc. Then there is the event, and then there is the celebrations afterwards, and then there is the copious amount of alcohol drunk. Put all those ingredients together, and you have a perfect storm for the transmission of infections from somebody who was infected and in your vicinity over a prolonged period of time. And we are already seeing cases that were generated by people who attended, for example, a local pub to watch the football.
Jeremy, I see you agreeing with what Bharat's saying, so please add to that. But I want to go back into Sweden. Hardly any new cases at the moment. It has been mostly voluntary over there. Why do you think Sweden appears relatively to have got off better than other countries?
It's not that no precautions have been taken in Sweden. It's that, there's been sort of that mid-level of precautions that have been taken over a longer span of time. But, it's a very complicated situation to try and say, how does that compare to what's been going on in the UK? But,
But in the UK, is it all or nothing? And in Sweden, it's just been this nice, sensible middle ground.
yes, and there's also a very different level of sort of personal responsibility that has been going on in Sweden, and a very different level of testing and surveillance that's been going on in Sweden. But yeah, the UK has very much had this reactionary, what is happening right now and in the next 2 weeks, and we're going to shift from one extreme to the other and back again. And that does not work very well.
Let's bring up a graph that shows the number of daily coronavirus cases in the UK from March right the way through to July of this year. You can see it's at its peak in January, February, somewhere between 50 and 60,000 a day. But right now, and of course this program goes out a few days after these figures were published, it's well over 35,000 and probably still rising. Oksana, do you want to make a guess as to whether we may see the levels hit the level at the point that they did in January, 55, 60,000, or whether we could go beyond that?
Well, certainly according to even Public Health England itself, the projected figures there are really dwarf those January figures. So really ranging between, we've heard from Sajid Javid, the health secretary, that it could be over 100,000, and from Susan Hopkins that it could be even as high as 200,000 cases. And really what that spells out is not only straining the healthcare system, which already we see elective surgeries being canceled and certain cancer-related care also being postponed. All of these aspects are happening right now, and that's without taking into consideration that lag time. So we will see an effect following the sporting events that have happened with mass audience, even though it did require either vaccination or lateral flow testing in advance. Now, even Imperial College London has shown that if we see vaccines effectiveness starting to fade over time, which could occur, whether that's in the people who have received AstraZeneca or in the light of a more dangerous variant, we shouldn't assume that it stops at Delta and nothing worse could come, that the very worst figure could be something like 12,000.
Okay, and so you're
hospital admissions a day.
12,000 as opposed to 1,000 to 2,000, which some people were suggesting.
If the vaccine effectiveness decreases.
So boosters, we're going to have to work on new forms of the vaccine to be used as boosters, either to bolster what we already have or to take on any other new variants. Bharat, do you want to pick up on that?
So whilst we are focusing on boosters, I think the better energy would have been spent in immunizing 12-year-olds and above. With respect to the boosters, they will be reformulated to mirror the dominant strains that are in circulation at that point in time. I'm not against boosters, but I really think that we are diverting our energies and ignoring other things like immunizing children instead.
Well, can you not see some kind of societal or parental backlash against saying that these 12-year-olds and above, let's say 12, 13-year-olds, are being used as sort of junior guinea pigs?
No, not at all. These vaccines have been licensed. We are not giving them something which we think is unsafe, and there is form on this matter. So every year we immunize against the seasonal influenza infections in schools. We also give children the HPV vaccines, and all of these are there to protect the population, to protect the individuals. And remember, these vaccines are going to protect you from severe illness, number one. Number two, they're going to protect you from long COVID. Number three, it is a preemptive strike in that were a variant to arise which causes severe disease in children, you will already have immunized your population, and hopefully there will be cross immunity against it. So we are using the window of opportunity to protect our children. It is not an experiment. I would never allow experiments in children. This is a protective measure for our children.
What percentage, Jeremy, of the UK population do you now believe needs to be inoculated? Or is it sort of like if we inoculate 60% of the 12-year-olds, then we're going to be much safer than if we inoculate 45% of the population as a whole?
There's been that argument for a long time of herd immunity, that once we get to some magical number, all of a sudden the virus is going to stop transmitting and we're all going to be safe. But in fact, we don't know if herd immunity is even possible with SARS-CoV-2 We don't know what number it would have to be. So what we do know is the more people you vaccinate, the more people that you protect. It's as simple as that.
Bit of history here, not that any of us around this table or wherever you happen to be will remember it, but 13th century, we had the Black Death, massive numbers of people wiped out, but in the end, the virus died out. Or was it a bacteria? I can't remember what it was. What was it that caused that to end, and could the same thing happen perhaps with SARS-CoV-2?
It is a bacteria, and it does still exist, and it does still cause outbreaks in certain areas. But it's, we are looking at something that the virus is going to continue to evolve. It's going to change, but it's a respiratory virus that spreads from person to person. And so, as long as the virus is present in the world with the interconnectedness right now, the virus is still going to be around. It's probably going to change, but it's affected by our actions, what we do and what we do now.
So really we do, Oksana, have to learn to live with it. It's going to be here. It's not going to go away.
Certainly, I think that based on the fact that we did not take a coordinated global approach in either tackling or vaccinating the world, yes, we will see that this virus will be with us. But how we decide to live with it, what measures we have in place in order to keep the population safe, that I think is something that we don't just say brush aside and do nothing about. Just as we have normalized certain public health measures for other conditions, this is now the next frontier, is ensuring that we have a good respiratory hygiene and protection for children and for adults.
Bharat, do you feel for Boris Johnson in the decisions that he has to make? I quoted irresponsible and perilous at the beginning, the thoughts of the BMA's leader. But do you understand how he has arrived at the decision he has arrived at? To say, we have to have freedom, there may be a price to pay for that.
I think the unfortunate bit here at play is that his backbenchers are pressurizing him into making political decisions when he would have been in a much better position if throughout he had remained scientific and be led by the science and not by his backbenchers. And one way to also get political purchase would have been to have a coalition task force, coalition of other parties acting independently in the interest of the nation on handling the pandemic, rather than his Secretary of State and his government handling it by themselves.
This is for all of you. Jeremy, I'll come to you first of all. When you were previously on the programme talking about this, did you ever think we would get to a stage where we were lifting restrictions when there was a possibility that there could be well over 100,000 infections a day?
No, I never thought that we would be directly there. But, given the history of the UK response and how it's been swinging, I can't say that I'm terribly surprised. I'm just disappointed.
Oksana, you've been on a number of times. What about your thoughts when you look back at the programs we've done together and you look at where we are today?
Well, I think part of this is just a reluctance to learn from mistakes. We haven't heard very much acceptance of the problems that occurred out of politicizing some of these decisions. And I think the reluctance of leaders to face that is why we are repeating the same mistakes again today.
Young people need to be vaccinated seems to be the strongest message that you are trying to get across, other than the fact that people need to be in the fresh air or open up the doors when they're in schools or places. When it comes to young people, Bharat, whose job should it be to persuade them and their parents that this is the right route to go on? Because young people might well be very scared.
So I, as a public health infectious disease expert, would immediately say it's definitely not the job of the politicians, because they have a low level of faith and trust amongst the public. But we, the public health people, pediatricians, general practitioners, are best placed to talk to our patients, talk to our parents, and show them the benefits of being immunized and protecting our children. I have done this job for over 30 years, and when I had parents very worried about the MMR vaccine and the spurious incorrect link with autism, I was the man in front persuading them not by lies, but by facts and evidence that this is how it works, this is how it protects, and this is how we should look after our children. So those are the people who should be enabled to take the message forward, not the politicians.
Okay, one very, very quick one from you, Bharat, if you don't mind. Is the worst over or still to come?
We are not handling this very well globally. So we expect all sorts of things to arise from uncontrolled infections in other parts of the world. So we brace ourselves for unexpected things. It's not over.
Oh dear. Listen, thank you. Thank you very much indeed. It's always good to see you on the programme. I wish I could say one day we no longer have to call you upon your services, but that day hasn't arrived yet, although July the 19th has. Thank you. Thank you very much indeed. Thank you. Wherever you're watching this edition of Roundtable, you can get many more of the shows on our YouTube channel. That's TRT World Roundtable on YouTube. From me, David Foster, and from the Roundtable team, we thank you once again and hope to see you next time. Till then, goodbye.